Thanks for joining us, everybody. We're here today to talk about actions the state is taking to promote more testing and treatment for syphilis, which has increased dramatically over the last few years, 7 times, and it looks like it's doubling again this year, especially congenital syphilis. And the focus of these efforts is around pregnancy and testing and treatment during pregnancy. So Dr. Herlihy will talk about what syphilis is, who's at risk, but people should know that this is a treatable disease for adults. A course of penicillin generally does the trick. Some adults have very mild symptoms. There's a lack of diagnosis. Others who are symptomatic get treated with penicillin. But the real danger here is for newborns. And the fatality rate is significant for newborns who are born from a mother who has syphilis if it's untreated. Routinely, people are tested during their early pregnancy for syphilis, but what we want to offer to make sure that across the state, anyone who's pregnant can also get offered a syphilis test. It's a very simple, easy test, very low cost, and it's covered by insurance in nearly all cases, covered by Medicaid. We're going to talk about the different ways that that's done so that they can be treated prior to birth and reduce the likelihood of infant death, as well as long-term negative health impacts for the infant that can be very difficult, painful, and costly for a long time. We've seen a 7-fold increase in syphilis in the last 5 years. And again, the main risk is around birth and infants. Of course, it should be treated for people of all ages, and it's a very simple course of penicillin that does it. We have a comprehensive approach across our different state agencies. People are particularly at risk of syphilis in corrections and detention and homeless. And I want to thank Dr. Rachel Herlihy, who will be presenting about syphilis, Jill Ryan, the head of CDPHE, Dr. Randolph Mall from Department of Corrections, Jana Locke from Department of Public Safety, Michelle Barnes, Department of Human Services, Mike Conway, Division of Insurance, and Pete Walsh from Healthcare Public Financing. We're also joined by our Lieutenant Governor, Diane Primavera, Dr. Michelle Barron, Sheriff David Lucero from Pueblo, and Allison George, the Director of Housing with DOLA, and Danette Smith with the Behavioral Health Authority. This disease is easily treated, but it can be very harmful and deadly for babies. And that's what we're sadly seeing across our state. And we hope to save many babies from death and from suffering and long-term health consequences through the simple way of doing more testing for people who are pregnant and getting them on penicillin. This is also especially important for people who don't have access to routine prenatal care. So that's why, again, focus on homeless and others who might not have the regular neonatal visits is going to be a critical part of this response. And we believe that this comprehensive response will help turn the corner and hopefully start sending the trends the other way, save the lives of many babies and prevent lifelong health consequences from babies that make it through but have severe issues throughout their lives because of something that could have been prevented had penicillin simply been administered during the pregnancy. So with that, I'll turn it over to Dr. Rachel Herlihy to give a update on what syphilis is, what it causes, where it is in our state, and then we'll get to our statewide response. Dr. Herlihy.
Thank you, Governor, and thank you to all of you for being here today. My name is Rachel Herlihy. I'm the state epidemiologist and deputy chief medical officer at the Colorado Department of Public Health and Environment. This afternoon, I want to provide you all with a brief overview of what syphilis and congenital syphilis are as infections. I'll talk a little bit about the importance of treating an individual that is pregnant to ensure that congenital syphilis infections do not occur, and then talk a little bit about our data and talk about the trends that we've seen and really the need for public health action when it comes to congenital syphilis. So talk a little bit about syphilis and congenital syphilis. So Colorado is not alone. We have seen increases in syphilis and congenital syphilis across the country. And I want to define for you what these infections are. So syphilis is a sexually transmitted infection. Individuals with syphilis don't always show signs or symptoms, meaning that someone who is infected with syphilis can spread the infection to someone else without knowing it. When syphilis is untreated, it can be serious or even deadly, especially infections that extend on for a period of time. It can result in a variety of complications to the heart, to blood vessels, to the brain. It can cause seizures, it can cause meningitis type symptoms, it can cause dementia, it can cause hearing loss, it can cause blindness. But the good news about syphilis is that it's highly curable with antibiotics and with common antibiotics. In fact, the antibiotic that we use most commonly to treat syphilis is a penicillin antibiotic. And congenital syphilis then is when untreated syphilis is passed in utero to a fetus. And that can lead to pregnancy loss, preterm delivery, infant death, and permanent medical conditions in babies. In fact, about 40% of the time when an infection is untreated, we see that an infant either goes on to be stillborn or we see loss of that infant in the first few months of life. We see serious complications that occur in infants that are in fact infected with syphilis, including things like loss of hearing, blindness, we see developmental delays, we see bone deformities, we see teeth deformities, a number of these complications, and many of them don't develop until later in life. So as I mentioned, across the country we are seeing increases in syphilis, including here in Colorado. From 2018 to 2023, we've seen cases of syphilis more than triple here in the state. Looking specifically at congenital syphilis infections, we've seen that increase mirrored, but actually seen an increase of more than 7 times when it comes to congenital syphilis cases. In 2024, we have already seen 25 cases of congenital syphilis, including 5 stillbirths and 2 neonatal deaths. This slide shows you some of the data that we are tracking when it comes to syphilis and congenital syphilis. The left side of this slide shows you a panel showing the overall number of syphilis cases that have occurred in Colorado since 2003. And then on the right side, you can see the number of congenital syphilis cases that have occurred in the state. So you can see that really rapid rise in cases over time, including more than 3,000 cases in 2023. On the right side, you see our congenital syphilis cases, and you can see that in 2023, we had 50 cases. As I mentioned, we've already had 25 cases this year, putting us on track to perhaps have more than 100 cases in 2024 by the end of the year. You can see if you look back about a decade, we did not see congenital syphilis cases in Colorado. They were rare or sentinel events occurring. So many years where we saw 0 cases. Next slide, please. As I mentioned, the good news here is that syphilis is curable and treatment will save lives. When caught early through testing, syphilis can be cured with antibiotics like penicillin. Congenital syphilis occurs in about 70 to 100% of babies that are born to someone who isn't treated during their pregnancy, but only 1 to 2% of babies who are born to a parent who received treatment. Resources, testing, and treatment are available here in Colorado at low or no cost. And with that, I'll hand it over to Director Ryan. Thank you.
Good afternoon. Thanks for coming. My name is Jill Hunsaker Ryan. I'm the Executive Director of the Colorado Department of Public Health and Environment. So, as Dr. Herlihy talked about, we're seeing an alarming rise in the syphilis rates, considered to be rare just a few years ago. And really, if there are 2 statistics to explain why we're here today, it's these. First, according to the Centers for Disease Control and Prevention, approximately 40% of babies with untreated congenital syphilis may be stillborn or die from an infection. Second, there have been 5 stillbirths and 2 neonatal deaths in Colorado this year as a result of congenital syphilis, and it's only the middle of April. The Colorado Department of Public Health and Environment is launching an all-out infection control effort aimed at reducing syphilis more broadly in the general population, as well as among those who are pregnant. Finding cases and getting people treated early in the disease process is our goal. Therefore, I'm going to issue a public health order which will give women the opportunity to be tested and treated to prevent our youngest residents from experiencing the long-term consequences of an in utero syphilis infection, or worse, stillborn or newborn death. This public health order will go into effect on April 25th and will affect providers to offer syphilis tests to pregnant people. This is in line with a CDC call for action to respond to national congenital syphilis trends. We know that a lack of timely testing during pregnancy contributed to 88% of congenital syphilis cases in 2022. These are considered opportunities missed. The public health order calls for increased testing throughout pregnancy. This means testing in the first trimester and at the time of birth. There's also required testing if someone who is pregnant goes to an urgent care center or an emergency room without having had prenatal care, or in the event of a miscarriage after 20 weeks gestation or stillbirth. Again, these pregnant people have to be offered the test. They do not have to take it. But this will apply to all healthcare settings and providers who care for anyone who is pregnant, including those in jails and prisons. As part of our work to reduce congenital syphilis, we've already been collaborating with the Pueblo County Jail and Pueblo County Public Health Agency to bring testing and treatment to anyone who is pregnant in a county jail setting. Together, we've made great strides, which have allowed us to expand this pilot project into other counties. This public health order will ensure that the same level of service is happening across the state. And today with us, we have Sheriff David J. Lucero, and he's here to talk about the success of the program in Pueblo. We are very thankful to Pueblo County for helping us determine the best way to prevent congenital syphilis in a population that may not receive any prenatal care any other way. In addition, the governor has called upon state agencies to help the Colorado Department of Public Health and Environment curb this epidemic. This includes the Behavioral Health Administration, Department of Local Affairs, Department of Healthcare Policy and Financing, Department of Human Services, Department of Corrections, Department of Public Safety, Department of Regulatory Agencies. So it's really an all hands-on-deck approach, and you'll be hearing from these agencies in a little bit. But first, I would like to introduce the Sheriff of Pueblo County, David J. Lucero.
Well, thank you for that introduction. Appreciate that. Thank you all for being here this afternoon. Good afternoon. The Pueblo County Sheriff's Office, in partnership with the Pueblo Department of Public Health and Environment, was honored to be chosen for a CDPHE pilot program beginning in 2021, which focuses on the prevention of congenital syphilis. Our testing is not just for those who are pregnant, but for all who could become pregnant, and this testing is offered on a voluntary basis. So far, our program in Pueblo County has screened 634 people who were incarcerated, and of those, 182, or 26.7%, were positive for syphilis. Of the 634 people screened, 27 were pregnant, and 7 of those were positive for syphilis. Treatment was completed on 70% of that population. I should also note that should a positive person be released from custody prior to treatment, our local health department works to locate them to ensure that they complete the treatment. Without our program, these patients who had received no prenatal care would never have been tested and connected to the treatment. Without access to the testing, these patients likely would not have been diagnosed with syphilis at delivery, and their babies would have been born with congenital syphilis. Without a doubt, this program saves lives. And because of the success of our program, El Paso and Jefferson counties also now have similar screening programs. So today, I'm glad to see this action being taken at the state level to keep people across the state safe and healthy, regardless of their life circumstances. Thank you.
Good afternoon. My name is Randolph Mall. I'm the Chief Medical Officer for the Department of Corrections and Health Authority. At the DOC, we have an unwavering commitment to the health and safety of every individual under our care.
structures to support interagency collaboration, and developing communication materials for law enforcement to raise awareness. Together, we can help address this challenge and keep people healthy. Thank you, and I will turn it over to Commissioner Conway.
Good afternoon. My name is Michael Conway, and I'm the Insurance Commissioner for the state of Colorado. I want to thank the Governor and the Department of Public Health and Environment for prioritizing Coloradans at risk for syphilis. This order will undoubtedly save lives, and thanks to the Affordable Care Act, testing for syphilis is covered without copays for the vast majority of Coloradans. That means we are able to provide this life-saving testing at no cost, at no copays for Coloradans. If you have questions about your coverage, please reach out to the Division of Insurance by visiting doi.colorado.gov, and we'd be happy to assist you. Today's action is one of the many ways we are working to make critical healthcare services affordable and accessible to all. And with that, I will turn it over to Michelle Barnes.
Thank you, and hello, everyone. I'm Michelle Barnes, and I'm the Executive Director of the Colorado Department of Human Services. Through testing, education, and support, we can help people stay safe and healthy, and that's what we're doing as part of Human Services. We're doing this in 3 ways. 1, we're ensuring that all healthcare providers at our state hospitals, youth detention and commitment facilities, and other facilities that support vulnerable populations, as well as working with all of our county and health partners, ensure that they have the most up-to-date information and testing availability. Secondly, we're working with our human services partnerships and programs in communities across the entire state to ensure that they have the information they need to educate their communities. And third, we're also working closely with DOLA and the counties to share information through our homelessness initiatives. We look forward to partnering with everyone here to address the rise in cases across the state, save lives, and support perinatal health. With that, I'd like to introduce Dr. Walsh.
Good afternoon. I'm Dr. Pete Walsh. I'm the Chief Medical Officer for the Department of Healthcare Policy and Financing, also known as HCPF. Our department administers Health First Colorado, Colorado's Medicaid program. And we're 100% focused on improving access, quality, and the equity of medical care our members receive. Health First Colorado covers 1 in 4 Coloradans and over 40% of births, as well as 40% of children in the state. Syphilis, as well as congenital syphilis, has had a profound impact on Medicaid members. The actions being announced today will help keep people safe and healthy and improve the quality of care they receive. The syphilis testing directed in this order is covered for Coloradans with Medicaid through Health First Colorado. Coloradans without health insurance who believe they may qualify for Medicaid should apply for Health First Colorado coverage. They can go to healthfirstcolorado.com to receive instructions on how to apply. Thank you.
Hello, my name is Dr. Michelle Barron. I am the Senior Medical Director for Infection Prevention and Control at UC Health. As others have already described, syphilis is the great masquerader. It can present in so many different ways that sometimes the diagnosis is not considered until later in the course, or individuals are asymptomatic, and so testing is never offered, and obviously treatment is never offered as well. The other piece of this is that so many people don't even realize they're at risk, and so they don't ask for testing, or providers don't think about offering it. UC Health is committed to work with CDPHE and the governor's office on expanding access to testing and ensuring that individuals that are positive get treatment. The goal is to prevent these long-term complications that can be terrible in all aspects, and also ensure that we can help prevent transmission by treating these individuals proactively. Thank you.
Okay, happy to take any questions.
Make one bigger from you then proposed. Is there any sense of why we're having so many cases this year? It was already rising, but it seems like even more than usual. Yeah, so as I mentioned earlier, the trends that we're seeing in syphilis and congenital syphilis are mirrored across the country. So if you look across the country, by region, it's pretty consistent that these increases are occurring, and there's probably multiple reasons behind these increases. When we look specifically at some of the risk factors that are associated with the cases that we're seeing here in the state, we do see issues of substance use associated with cases. We also see cases that have an association with corrections, individuals that have been in jail. And so really the risk factors and the data that we're seeing are really what is driving the approach that we're taking with this public health order.
And just those numbers that they had from the Pueblo pilot, looks like about 20% positive. We're sure if Lucero go, something like about 100 and 400, something like that. I don't know, 50.
26.7%.
Positive, 26.6. I mean, so what I think, in part, answer your question, I think you're seeing jails and prisons as a place where this is spreading. Eventually, people get out, and that they also can spread it in the general community. So I think we're addressing keeping general society safer by really focusing on what's happening in jails and prisons. Yes.
Can I ask a follow-up to that? So you're not saying that the drug use activity or jails themselves are what is causing the increase? It's just there's an association between cases and those populations?
So I'll let Dr. Herlihy address the causes. It is generally a sexually transmitted disease. I think it can theoretically be transmitted through blood and shared needles, but that doesn't seem to be as common a vector. Anyone want to address that?
Yeah, so I think the common link and the association here probably has to do with access to prenatal care and complicating factors in individuals' lives that are leading to them not receiving prenatal care. And again, I think that goes back to the approach we're taking here, where we're trying to find people where they are and where they're receiving health care, whether that's an emergency room, urgent care setting, or in a correctional setting.
I just want to be clear, so as it is state law required testing in the first trimester,
One test.
right? So this is then expanding the times during pregnancy and then bringing it into more correctional facilities?
So yeah, there's a few things happening. So hopefully you have materials that show several things happening. But yes, rather than just being offered once, and obviously some providers might already have offered multiple syphilis tests, all healthcare providers, including emergency rooms when they have a pregnant woman coming in, will be offering a simple, low-cost syphilis test. And then if it's positive, treatment will be offered, which is also covered under Medicaid for most of this population and covered under private insurance plans. Great. Thank you all very much for joining us today and getting the word out. We look forward to tackling this head on, and we hope to reverse this trend and help save some lives. Thank you.